simply, again, AI in a black box that solves only one purpose. We look at it as a platform. And I think we all need to look at these solutions as platforms that can evolve from where we are today to over time. And we always bring in a level of governance to these initiatives. These are not IT or digital initiatives at face value. They are operational, they are clinical, they are business, they are process improvement initiatives. These are focused on, again, something we're trying to solve for. And so if we say these are IT problems or IT projects, I can tell you they're not going to be successful. So we always look for that right level of executive sponsorship and ownership to help facilitate these sort of things from happening.
I think a good AI partner is one that can scale across your enterprise. And the majority of us now work in healthcare systems versus standalone entities. And so the scaling and the enterprise view of a health system is incredibly important. Can we use multiple solutions on one platform? Does the platform allow us a communication vehicle? And one example that I'm going to use with you is one that you know very well, AI Doc. Instead of buying a product, we felt as though we've engaged in a solution, and that solution allows us to continue to scale and expand a platform while also providing the essential communication components required for this technology.
I think that a lot of these decisions have to be driven based around delivery of care to the patient and what we often will call the triple aim: the best quality care with the best patient experience and the best value, lowering the cost of care. So that's a tried and true model. And I think that when we think that, and the whole point of AI is that it should be delivering on that, right? AI does promise that idea that we can deliver great care quicker and at a lower cost. Otherwise, you shouldn't really be looking at the solution, in my mind.
It's that seek first to understand component of this is like, hey, what's important to this organization? What are people being measured on? What are people focusing on to make sure that they're getting right? And I think a partner stops to understand those things, and then they understand how their tools can add value and focus on the ability to add value both to the clinical workflow, to the financial elements of an organization, but are very focused on helping the health system achieve their outcomes, not their outcomes.
We want to understand whether the problem is truly at a provider level. It's a one-off problem that we are trying to solve, but our preference is always to take a system approach. It also enables a good debate about what we should be doing as a system, because certainly what we don't want to do is, getting into a hype of AI technologies, getting too swayed with what we call as a tech toy syndrome, that we want to implement every technologies for every use cases. So we are very pragmatic about how we introduce these technologies in our healthcare system and how does it align and solve our key issues that we are trying to solve as a system.
If you have a development roadmap and you want to just execute on that roadmap, that's awesome. We probably are not going to partner with you. If you want to work with us to suss out the use cases that we think are important within Ochsner, we'll likely generalize out to other organizations and are willing to get down in the trenches with us and start and working through those changes. That's going to be an organization that we're going to partner with.
If you implement AI without a thought to what your long-term integration and AI interoperability platform plan is going to be, you're likely to head into the same problem we've dealt with around interoperability in general. And I think a partner understands that. And a partner comes to the table and helps you not just plant a tree, but helps you design where all the trees are going to go, but also what they're going to look like in 20 years when they all grow up. So it's just not as mismatched, but it's this really beautiful orchard that has been cultivated over a period of time and thoughtfully planned. And I think a partner comes to you with that long-term vision because they plan on being there for a while, versus selling you this point solution and moving on.
The foundational integration with our EMR, we've all invested so much time, money, labor, effort to continue to see the value out of these integrated EMRs. Integration with these AI platforms, we deem as being a key factor for consideration. It's got to be kept simple. You know, the workforce, really, their primary mission is to take care of patients and not to have overcomplicated technology put in front of them. So keeping it basic, keeping it transparent, and keeping it easy to understand would probably be the greatest lessons learned at the most simplistic level with regard to AI today.
So understanding, even if the companies haven't declared it first, like where are those partnerships occurring? Because that's also going to be really more sustainable and prudent for your IT systems, to your IT team, if they can work with vendors that are already integrating their platforms together.
AI itself is not transformative. It's the workflow that you insert that AI into, the people, the process, and the technology. And you have to have all three. You have to have the right people, you have to develop the right process, and you have to integrate the technology in the right step of the process. If any of those things are out of balance, you don't really see major change.
Do we have the capability of expanding this? Is our infrastructure, whether it's technology or through the workforce, scalable to support this? And when I talk externally also, has the technology passed the check gates, so to speak, in terms of provider, in terms of patients? Provider, are they accepting this as the right technologies to be embedded in their workflow? And have we done good education with the patients or the healthcare consumers, how it impacts their healthcare outcomes?
We have to try to do some things with the caution of not trying to boil the ocean and trying to do everything and know that, that this is going to be perfect. So, what do we say? Perfect is the enemy of good. I think we are good at this point, and it will get more and more good or great over time. But this is going to be a process of great learning, and our tools are going to get more sophisticated, and we're going to get better at leveraging these tools over time.